Noon. Selam, merhaba, khosh aamdeed, sawadika. On behalf of Indian Association of Cosmetic Gynecology, Patna Obstetric and Gynecological Society, and especially Sun Hospital Patna, I welcome you all to the much awaited Indian Regenerative and Cosmetic Gynecology Congress 2024 in the holy and historical city of Lord Buddha and Samrat Ashoka. Regenerative and aesthetic gynecology is a new horizon of women's health as it unveils the untouched, unexplored, and undefined aspects of a woman's well being, which they hesitate to reveal, therefore, suffer in silence. So, all thanks to Indian Association of Cosmetic Gynecology, which is carrying the baton to open a new vista of regenerative and aesthetic management with most recent and updated innovations and techniques to rejuvenate, repair, and reshape a beautiful human body. Congratulating Sun Hospital Patna for the grand organization of this Irag Congress 2024, especially Dr. Mini Anand, the organizing secretary, with many international faculties. This conference has truly turned international. Saluting Patna Obstetric and Gynecological Society, which is also in association hosting this conference, for their series of scientific conclaves in 2024, I welcome each member of today's August gathering as we call upon our honorable dignitaries today to the dais. Dr. Charu Modi, to do the honors, please.
Thank you, Madam. So, to formally start with the inaugural function, may I request the following dignitaries to kindly come up the stage. First of all, I would like to request Dr. Garima Srivastav, President Indian Association of Cosmetic Gynecology, to kindly come up. Please give her a big hand. Next, I would like to request Dr. Meena Samant, President of Patna Obstetric and Gynecological Society, to kindly come up. Then I would like to extend a warm invitation and welcome and invite our guest of honors, Dr. Pramila Modi, Madam. She is also the past president of our society. Madam, kindly come up the stage, please. Now I would like to invite our another guest of honor, a very great academician of our society, Dr. Sushma Pandey, Madam, to kindly come on the stage. It's a great honor and pleasure to invite our chief guest, Padma Shri Professor Dr. Shanti Roy, Madam, to kindly come up. Please put your hands together for our chief guest. Now I would like to invite our Secretary, Patna Obstetric and Gynecological Society, Dr. Amita Sinha, to kindly come up. I would also like to request the man behind this show, Dr. Rajiv Anand. Sir, kindly come on the stage, please. And finally, last but not the least, the lady behind the whole conference, Dr. Mini Anand, our dynamic organizing secretary, is requested to kindly come up the stage. Madam Ranjana Sinha, Dr. Ranjana Sinha, you are requested to kindly felicitate our dignitaries on the dais. Thank you so much, Dr. Ranjana. I welcome all our esteemed dignitaries on the dais. And now I would like to invite the President IACG and co-founder Orange Clinic, Dr. Garima Srivastav, to kindly come and give her welcome address.
Distinguished guests, esteemed colleagues, and respected seniors, me and Dr. Mini Anand welcome you all to the Iraq 2024. This conference brings together a remarkable group of professionals, all at the forefront at this ever evolving new field. We are here to share knowledge, discuss advancements, and explore the latest technique in aesthetic and regenerative gynecology. Today, we'll be discussing the various opportunities to treat and improve the women's health care by our various national and international faculties. This conference is not just about the latest technology or procedures, it is also about fostering an open communication and skills between all our members. Let's use this platform to push the boundaries of aesthetic gynecology and ensure that women everywhere have access to safe, effective, and empowering healthcare solutions. On behalf of Dr. Mini and me, I welcome you all once again to the Iraq 2024.
Thank you so much, Dr. Garima, for coming to Patna for this Congress, organizing it, and for your words. Next, I would like to invite Dr. Meena Samant, grit, guts, heart, and passion, with which. Okay. Okay, so we will move over to the lighting of lamp first for the customary inauguration of this Congress. ऊपर करवा देना A lamp lighting ceremony marks the beginning of a journey towards brilliance and greatness. Deepam signifies knowledge, and all our activities should be governed by the light of knowledge. May I request our chief guest, guest of honor, and dignitaries on the dais to light the lamp of knowledge. May I also invite our international faculty members, who are our distinguished guests across the globe, to join. Dr. Nopawari Chantowong from Thailand, Dr. Saibel Ustunel from Turkey, Dr. Baherahe Arbabi from Iran. May I request you all to kindly join for lamp lighting ceremony on stage. Please, yeah, Dr. Nopawari, please come on the dais.
शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुत्वं कल्याणं आरोग्यं धनसम्पदः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तु ते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
I thank all our dignitaries on the dais and our international guests who have just inaugurated the conference with lamp lighting. Moving on with our scheduled program, grit, guts, heart, and passion, with which our President Patna Ops and Gynae Society is known for holding organizational leaderships and many conferences, Dr. Meena Samant, HOD Ops Gynae, Kurji Holy Family Hospital, immediate past Vice President ISOPAB, and current ICOG Governing Council member, is super energetic and dynamic leader. May I request you, ma'am, to address the gathering?
Thank you. Respected dignitaries on the dais and off the dais, a hearty welcome to one and all to this very important and a novel, I think for Patna, it's one of its first of its kind, the Irag Congress 2024. Respected Chair, our chief guest, Padma Shri Dr. Shanti Roy Ma'am, our guest of honor, Dr. Modi, guest of honor, Dr. Sushma Pandey Ma'am. Of course, the lady behind today's program, in fact, the ladies, Dr. Garima and Dr. Mani. These two beautiful ladies, they've put a grand show together here. A hearty congratulations to both of you. And of course, their team, which includes our secretary, Dr. Amita, Dr. Anand is here. So we know behind the scenes a lot of work goes, and the whole team, Dr. Charu and all. Hearty welcome to each and every one of you. I think today's scientific agenda is so grand. We're going to learn something new. Already this morning sessions have taught that it's not just, talking about disease. It's the quality of life that is so important. And something without, surgery, we can, improve the quality of life, things that are just ignored. So I think today's scientific agenda is going to be a fantastic one and have something to learn for all of us. So once again, a hearty welcome to all. We have faculty from across the globe, and I think they will enjoy the hospitality of Bihar, Patna, and they have time to visit, and see the grand, the historic Bihar that we have here today. Thank you very much.
Thank you, madam. Now I invite a very dynamic and fervent secretary with tremendous work to her capacity, the Secretary of Patna Obstetric and Gynecological Society, Dr. Amita Sinha. Madam, may I invite you for your forward-looking message?
Respected Chief Guest Dr. Shanti Roy Madam, Guest of Honor Pramila Modi Madam, Sushma Pandey Madam, Organizing Chairperson Dr. Garima, Secretary, Organizing Secretary Mini, our Intelligent President POGS, Dr. Meena Samant, two beautiful conveners, Dr. Charu Modi Ranjana, and our international guest speakers, all the delegates and faculties from all over the Bihar, media person. A very good afternoon to all of you. पटना की धरती से हम आप सबका स्वागत करते हैं. एक नमस्ते बनता है आप इंटरनेशनल स्पीकर्स के लिए. जी हाँ, नमस्ते. इन बातों के साथ फिर हम आगे बढ़ते हैं. और what about the scientific program? Everything has been crafted so beautifully by our organizing team and Patna OBGY Society. It's honor for POGS to associate with and to host so many conferences this year. So it's a really pleasure for us to learn something, to arrange something. And for that, I would like to congratulate again Dr. Garima and Dr. Mini Agrawal. But I can't forget Mr. Dr. Rajiv Anand to help him, to support him throughout this program in arrangement and looking after. He is also here from very morning, and I hope he will stay till evening. Thank you so much, Dr. Rajiv Anand, for doing so much help to our society, to Mini and everyone. Thank you so much. Once again, I welcome you all.
Thank you, Dr. Amita, for your beautiful words. With her aura, the atmosphere turns spiritual. With her knowledge, she mesmerizes the audience, and with her meticulousness and discipline, she inspires our next generation. Ladies and gentlemen, please welcome Dr. Pramila Modi, our versatile past President Patna Ops and Gynae Society, and our guest of honor today. She has rhythm, she has melody. Even her words flow like divine Ganga. Madam, please bless us with your pearls of wisdom.
Thank you, Ranjana. So, a very good afternoon to one and all. Respected Dr. Garima Srivastav, President of Indian Association of Cosmetic Gynecology, as we know, today we are here to celebrate Indian Regenerative and Aesthetic Gynecology Congress. We are very happy about it. And she is director of her own Orange Clinic at New Delhi. Now, Padma Shri Dr. Shanti Roy, chief guest of today's program, and truly speaking, she is a torch bearer for all of us, and she was head of the Department of Gynecology at Patna Medical College. To my left side is Dr. Sushma Pandey, a well-known gynecologist, and she is the guest of honor and was ex-HOD at PMCH Department of Gynecology and Obstetrics. Dr. Meena Samant, President POGS, Dr. Amita Sinha, Secretary POGS, Dr. Mini Anand, Chairperson of Sexual Medicine Committee POGS, Director of her own Sun Hospital, is the organizing secretary of today's function on cosmetic gynecology in association with ACG, POGS, and our course faculties, both national and internationals, as you are seeing them sitting. They are so lovely, look very young girls. And the delegates in the audience, and of course, we cannot forget, we can only thank Dr. Rajiv Anand, who is always with us in organizing the events. Thank you, Dr. Rajiv, for your good gesture. Our international faculties are Dr. Salman from USA. I believe he is not able to come and join, so he will be probably online. We will be able to listen to him. Dr. Sidal from Turkey, Dr. Bahi from Tehran, and Dr. Nopwari from Thailand. I hope I have pronounced properly. And they deserve special applause. Thank you. I remember the day when we met for the first time in the inaugural function of Aesthetic Cosmetic Gynecology held at Sun Hospital in March 2022. That means the organization is 2 years and 2 months old, a newborn baby yet. I congratulate Dr. Mini and other doctors who are practicing in this field for selecting beautiful topics in the scientific and also arranging the workshop which is going to happen tomorrow. These doctors are dedicated and would take the organization to greater heights. And I thank Mini, particularly the organizing whole committee, in inviting me as guest of honor, wishing for a grand success in the Congress for today and tomorrow. Thank you.
Thank you, madam, for your words of blessings. A charming smile, an elegant persona, an amalgamation of intellect, intelligence, and grand etiquettes, our guest of honor, Professor Sushma Pandey, ex-HOD OBGYN Patna Medical College and past Vice Chair ICOG, never fails to impress us with her organized life, clinical acumen, and forever young personality. Madam, please bless the gathering.
Thank you, Ranjana. Respected chief guest, Padma Shri Dr. Shanti Roy, the guest of honor, Dr. Pramila Modi, chairperson, regenerative and aesthetist gynecology, Dr. Garima, president POGS, Dr. Meena Samant, secretary POGS, Dr. Amita, and organizing secretary of this conference, Dr. Mini Anand, and the pillar of this Sun Hospital, Dr. Rajiv. And all my dear friends and colleagues, very good afternoon to all of you. Sorry, and all the international and the national speakers, Dr. Nopi, Dr. Sibyl, and Dr. Behraj, you are all welcome
in India and especially in Patliputra, city of Buddha. So my all the best wishes to all of you. And you know the cosmetic gynecology is a very fast growing branch, very fast growing, and today I have seen there is lot of changes has occurred. Even you can treat the male partner also, not only the female, and you can treat the female as well as the male from the head to toe. There are so many facilities, then you can manage the society especially. So my all the best wishes to this conference, Congress 24, and all the best wishes to organizer to arrange such a nice conference. Thank you very much.
Thank you, madam, for your blessings. Now, I would like to invite an inspirational personality who needs, in fact, no introduction. Past president and one of the strong pillars of POGS, a teacher, guide, and mentor to many, whose footsteps we youngsters follow. She has ignited and instilled love of learning in many. With these words, may I invite our chief guest, Padma Shri Dr. Shanti Roy Madam, to kindly bless us.
Very much, Charu, for your very loving and nice words. First of all, conference. All the dignitaries on the dais and off the dais, especially the guests who have come from outside Bihar, from Delhi, Dr. Garima, the organizing chairperson, and all our guests, international faculties who are here. We are really very, very happy to see you all here and taking part in this conference in our city of Patna. This branch, Irag, regenerative and aesthetic gynecology, it is really a new thing for our subject, gynecology. And it is very good, very nice that people have started thinking about those private problems which women used to suffer and used to bear in the past. In our days, the patients mostly remained silent and quiet if they got about some laxity of their vagina, the sex was not satisfying. These things were kept in herself, and she never uttered or complained all these things. Then fecal incontinence, urinary incontinence, stress incontinence, urge incontinence, they were very common. And in our days, what did we do? We advised for pelvic floor exercises for most of the problems. If it did not work, then we went for surgery, and they were surgically repaired. Now the surgery had its own disadvantages. The healing is usually by fibrosis. During surgery, anesthesia, local or general, had to be taken, which had some risk. There was a question of bleeding. There was risk of overcutting, undercutting. It might not be satisfactory, or it might be too tight. So all these things, the surgery was not always very successful, especially for stress incontinence. It was not always successful, and the fecal incontinence also. So in our days, we used to do only perineal exercises, and if it was not successful, then went for surgery. Now, it is very, very nice that a non-operative, conservative methods have come in, which can give a lot to women to maintain their problem, to maintain their problems which they used to keep among themselves, and now they can take help of our colleagues who are going for the aesthetic surgery. The laser and chair and the PRP and Botox, all these things are very new, and these things are being used. I am very glad that Garima has come. Dr. Garima is using it since many years, and she is a great advocate because she has seen the results. And it is a very pleasant thing that our own Dr. Mini Anand, she has taken a step ahead and she is taking interest, and many of her friends also have started doing it. So we have got a very satisfying tool with us. We can take help of them and we can advise our women to take help of these instruments. The only thing is that please remember that seva dharma hamara. So the cost should be kept to a minimum. Certainly the instruments must be very costly, but take care of the social position of our society and try to keep the cost within limits. So thank you very much for inviting me and giving me this opportunity to have a few words with you. Thank you very much.
Thank you so much, madam, for your message and blessings to us. Now is the momentous occasion, the book launch by Dr. Garima Srivastav on Practical Approach to Cosmetic and Regenerative Gynecology. A book, as we know, is more than just ink on paper. It is a portal to new realms, emotions, and concepts. Therefore, let us embark on a literary voyage and thank the incredible author and also share her knowledge and creativity in the field of cosmetic and regenerative gynecology with us. Without further ado, let's get this momentous book launch underway. For this, I request our chief guest and guest of honors to kindly do the honors. Many congratulations to Dr. Garima Srivastava for her book launch. Now I invite her to brief us about this book.
आप सबको pranam. I am very happy that I am getting to launch my book in front of the dignitaries in Bihar. Or I cannot have asked for a better launch of my book. Thank you, Dr. Mini, for making it actually possible. I will forever be indebted to you. Thank you, ma'am. आपने मेरा book छू के उसको और अच्छा कर दिया है. Thank you so much. Regarding the book, of course, it's about the cosmetic and regenerative gynecology, the fastest growing branch and here to stay. बहुत time से we have been only focusing on the reproductive health. Now this particular branch takes care of the female sexual health, mental health, physical health in the best possible way. जो भी authors हैं, the authors are expert in their own fields and they are international authors and eminent national authors in my book. I would of course like to thank all of them for contributing their immense value and knowledge to this book. May this book be the guiding realm in cosmetic gynecology. Thank you so much.
Many congratulations, Dr. Garima, on release of the book. And thanks so much, all the dignitaries on the dais, for this release ceremony. Now, moving on to our felicitations. Felicitations are our gratitude. Felicitations are for those who have walked that extra mile to achieve their dreams. And we have today so many luminaries who will inspire us with their success stories. So let us felicitate them. First of all, our chief guest, Padma Shri, Professor Shanti Roy ma'am. No words to describe her. Our teacher, our mentor, we just bow before you, ma'am, for your blessings. May I request our organizing chair, Dr. Garima, Dr. Mini Anand, the organizing secretary, along with Patna Obs and Gynae Society president and secretary, Dr. Amita Sinha, to felicitate her with a shawl and memento. Dr. Garima, aap. Madam has been teacher of teachers and our guide at every step. A photographer a photographer को कोई बुला दो ना साइमा फोटो खींच लो. Yes. मैडम के व्यक्तित्व से हम सभी परिचित हैं. मैडम हमारे लिए हमारी गरिमा है. मैडम के आशीर्वाद से हम सदा अभिभूत रहते हैं. Now, I would request our organizing chair and secretary, Dr. Garima, Dr. Mini, and Patna Obs and Gynae Society president and secretary to kindly felicitate our guest of honor, Dr. Pramila Modi Madam, एक स्नेहिल व्यक्तित्व जिनसे हमेशा हमें प्यार और दुलार मिला है. Kindly felicitate Madam Pramila Modi. Next, I would request again our organizing chairperson and secretary, along with Patna Obs and Gynae Society president and secretary, to felicitate Dr. Sushma Pandey, a replica of dynamism. Madam, we would like to felicitate you as our guest of honor. Next, may I request our chief guest, Dr. Shanti Roy ma'am and Dr. Pramila Modi ma'am, to kindly felicitate the organizing chairperson of this wonderful conference, Dr. Garima Srivastav, whom I always see as one person who is advocating cosmetic gynecology in each nook and corner of India. She is moving throughout country promoting cosmetic gynecology, Dr. Garima Srivastav. May I now request our chief guest, Dr. Shanti Roy and Madam Sushma Pandey, to kindly felicitate our most dynamic president, Patna Obs and Gynae Society, Dr. Meena Samant. Meena di. Thank you, madam. And now it's time to honor our friends from abroad. So we will felicitate our distinguished faculty members from abroad. In fact, your presence in this Congress is a historical moment. So kindly join us on stage. Dr. Nopavari Chantawong from Thailand, Dr. Sibel Ustunel from Turkey, and Dr. Bahare Arbabi from Iran. May I request President ISEG, Dr. Garima, Vice President ISEG, Dr. Mini, along with our chief guest and guest of honor, Dr. Shanti Roy, Dr. Premila Modi, and Dr. Sushma Pandey, ma'am, to kindly felicitate them. Dr. Nopavari Chatawang. Dr. Nopavari Chatawang, please. Okay. She has come all the way from Thailand to join us. Thank you for sparing your precious time and imparting us with so much knowledge. Next, it is our friend from Turkey, Dr. Sibel Ustunel. We are really thrilled to have you over here. And finally, from Iran, we have Dr. Bahare Arbabi. All these people, you have already seen their videos inviting us to this wonderful Congress. They have traveled from far away places to be with us and impart us training in cosmetic gynecology. Thank you very much, all our international faculties. We are really privileged to have our esteemed national faculty members too, who will be imparting training to our delegates in this Congress today. May I request Patna Obs and Gynae Society President Dr. Meena Samant and Secretary Dr. Amita Sinha to join our chief guest and guest of honor to felicitate Dr. Vidya Pancholia. We have 3 faculty members from Indore. Okay. I think she has left. And next, Dr. Praveen Agrawal, whom you have already heard from Indore. Sir is a renowned faculty in cosmetic gynecology at the National Front. May I also request Dr. Nitesh Prajapati to join on stage for felicitation. May I request Shanti Rai ma'am to kindly felicitate Dr. Nitesh Prajapati, sir. May I once again call upon our friends from abroad, Dr. Nopawari, Dr. Sibel, and Dr. Bahare on stage to do the honors of felicitating a few very senior and important people from our place. So Patna Obs and Gynae Society is known for its organizational capabilities and academic activities at the national front. We bow our heads to our respected past presidents of Patna Obs and Gynae Society who have led our society to new realms. Let me now call upon a stage Dr. Alka Pandey ma'am, past president Patna Obs and Gynae Society. Dr. Nopawari, kindly felicitate Dr. Alka Pandey ma'am. I'd like to request Dr. Kumkum Sinha ma'am to kindly come on stage. Dr. Abha Rani Sinha ma'am. Dr. Abha Rani Sinha ma'am? No? Okay. Dr. Neelam ma'am, kindly join us on stage. Without their guidance, our Patna Obs and Gynae Society would not have reached such place. So, we pay our gratitude to all the past presidents of Patna Obs and Gynae Society. And now it's time to felicitate Dr. Neelam madam. We have with us today a very hardworking and ever smiling personality and a person uh, who is with us despite some emergency at her home, Dr. Amita Sinha, our dynamic secretary, Patna Ops and Gynae Society. May I request Madam Shanti Roy and Pramila Modi ma'am to kindly felicitate her. And now it's my privilege to call a person who is the real strength behind this grand show, Dr. Rajiv Anand. Without him, I don't know how this conference would have happened in such a grand manner. Sir has been behind each step of Dr. Mini, and we all know what is the success mantra of a successful couple. So may I request Professor Shanti Roy ma'am, Dr. Meena Samant, Dr. Garima, Dr. Pramila ma'am, everyone to just felicitate him for Dr. Himanshu Roy. Dr. Himanshu Roy, kindly come on stage. May I also request Dr. Rajiv Anand sir to say a few words, how it worked, how he, he has managed to put up such a grand show. Sir, kindly say a few words.
Respected Chief Guest, Padma Shri Dr. Shanti Rai Ma'am, our guest of honor, Dr. Pramila Modi Ma'am, and Dr. Sushma Pandey Ma'am, President POX, Dr. Meena Samant, and Secretary Dr. Amita Sinha Ma'am, and Chairperson, Organizing Chairperson and President of Indian Association of Cosmetic Gynecology, Dr. Garima Srivastava. I think she is not here. Oh, she is there. Yeah. You always fascinates me and gave a lot of motivation behind this work, you know. So, thank you so much. I am really overwhelmed by the huge response of this conference. And to me, I know only this, I could understand this, that this cosmetic gynecology is the very fastest emerging branch of the gynecology. And this is going to help a lot of females of their sexual and psychological help. So definitely, and I am very much thankful to all the delegates from Bihar, Jharkhand, and other places of India. And I'm really, I bow my head of all the foreign delegates who has come from Tehran and Bangkok and other places, and one person is joining us online too, you know. So this is a matter of great pleasure and privilege for me to organize such a huge and beautiful conference. And behind that, my wife, she really worked hard. Dr. Mini Anand, give her a big applause. She really worked hard. Almost every day, she scolded me a lot of times, you know. She was always in tension how to do it and whether it will be good or not. But she really worked hard. I can say in the past 15, 20 days, she was on into it, you know. And I really thank all my pharmaceutical partners. They have really helped me a lot. And the Stingray, who has supported a lot in this conference. And I really thank all the press media and the electronic media and the print media who has come over here and captured all the things, all the bites, which is going to help the people of Bihar in this cosmetic gynecology. So once again, I really thank you everyone for coming and joining this Congress. And I really wish that the next year she is doing in Delhi will be a great success. Thank you very much, sir.
We all know how good organizer sir has been in the ortho field, but we have witnessed it previously also at Sun Hospital and today here also, his organizational capabilities, and how to forget the real face of this Iraq 2024 Congress, Dr. Mini Anand. She has worked day and night. I have seen her. I think she has not slept for last 3-4 days. And single-handedly she has managed, of course, with the support of Sir, everything of this conference, accommodation, the travel, the scientific program, everything she has managed so well. So Dr. Mini Anand, you really deserve a round of applause from the audience. Doctor, may I request our chief guest and our guests of honor, and especially Dr. Rajiv, to felicitate Dr. Mini Anand. The audience today in this hall is a real proof how successful this conference is. And Mini, you must be happy that all your efforts are really so fruitful. And next, I would like to call upon the most energetic and wonderful convener of this conference, Dr. Charu Modi. She is really perfect. In whatever she does, she is perfect. So may I request our chief guest and guest of honor to kindly felicitate Dr. Charu Modi. May I now request Dr. Charu Modi to kindly uh, invite Dr. Mini Anand for the formal vote of thanks.
I will request Chief Guest, Madam Shanti Roy, and Dr. Pramila Modi Madam and Sushma Pandey Madam to kindly felicitate Dr. Ranjana.
Let us now invite our dynamic and fervent organizing secretary of Iraq Congress, whose untiring and relentless efforts have shaped into today's conference. With these words, I invite the most polite and kind, the famous organizing secretary of today's conference, Dr. Mini Anand, to kindly come and propose vote of thanks.
Thank you, dear Dr. Charu. My list of thanks actually extends much beyond this piece of paper which I have got. You know, it is a lot more than that. Respected teachers, seniors, my dear friends, national, international faculty, all colleagues, all delegates. First and foremost, I wish to express my deepest gratitude towards God for blessing me with this beautiful life and whatever I have till now. I want to wholeheartedly thank my parents, because of whom I'm here today. Their unconditional love, support, and guidance has always showed me the way. Though they are no more with me, but I can feel them all around me. I also truly appreciate having the opportunity to express my sincere gratitude towards my teachers for their unwavering support, guidance, and belief in me. Your dedication, care, and unwavering support has always shaped me into a person, has shaped me into a person what I am today. The confidence that you all have shown in me is immense. शुरू से ही जब से ये स्टार्ट हुआ था, I have been talking, I think, to everybody. शांति रॉय मैडम, प्रमला मोदी मैडम, सुषमा पांडे मैडम आप ऐसे आएंगे, आपको आना है, and they are always like तुम करो and हम लोग हैं साथ में. So thank you very much, madam, for your unconditional love and support, madam. Thank you so much. Thank you for pushing me to be the best version of myself. Thank you so much once again. Thank you for believing in my abilities. I have so much to thank you, ma'am, that words fall short of it. Thank you again. Thanks a lot to all my teachers, my respected seniors. I take the opportunity on this platform to thank my organizing chairperson, Dr. Garima, who had the faith that I will be able to shoulder this responsibility. And thank you for giving me this responsibility. And of course, thank you very much for getting this conference to Patna. because you always had an option. We could do it in Delhi, we could do it in Lucknow, we could do it in Bangalore, but I requested her and she was always, ki, okay, theek hai, let's do it in Patna. So that's how this conference, our first conference, Indian Regenerative and Aesthetic Gynae Congress, is being done in Patna, Bihar. And I've been always talking to her. She's always available anytime, 24 into 7. Anything I had to ask her, she was anytime. She is actually a, massive traveler, that I can say. She's traveling to kabhi China jayegi, kabhi kahan jayegi, kabhi kahan, all over the world. Lekin in spite of the fact, she's always on the phone and to answering to all my phone calls. Thank you so much, Dr. Garima. I am also very thankful to the President, Patna Obs and Gynae Society, Dr. Meena Samant, and Secretary, Dr. Amita Sinha, who could provide me with an appropriate time out of the busy schedule of POGS programs. They're always in line so, to conduct this conference. Thank you so much, Dr. Meena and Dr. Amita. They've always been with me. I mean, anything I needed, they were, okay, karo. And Dr. Amita, special thanks goes to you, because in spite of the problems which you are facing right at home, the health problems you have at home, you are still here. Thank you so much for that. I'm extremely thankful to my international faculty members, Dr. Sibel, Dr. Bahare, and Dr. Nopuri, who have come all the way from Turkey, Tehran, and Thailand, respectively, to talk to us about the latest in regenerative and aesthetic gynecology. My heartfelt thanks to you all. I mean, you all have been just marvelous. Traveling that distance is, it's very boring, and it can be very hectic. In spite of the fact you had a headache, Dr. Sibel, yesterday, thank you so much, all three of you. I love you all. Thank you. Thank you. And I'm also extremely thankful to Dr. Salman from USA, who will be online for his lecture and discussions. I'm very thankful to my national faculty, Dr. Vidya Pancholia, Dr. Praveen Agarwal, and Dr. Nitesh Prajapati, who have given their, and few will be giving their valuable tips and tricks related to Regenerative and Aesthetic Gynae Congress. I have no words to thank all my most talented chairpersons and lovely panelists who readily agreed to whatever responsibility I showered on them. Thank you very much. You all have come from very far off. So thank you once again. Dr. Archana, I think you landed at 2 in the night. Dr. Archana, Dr. Roma. It's a big thank you to everybody. Thank you very much. Now, words fall short in thanking my conveners, Dr. Ranjana, my right hand, and Dr. Charu Modi, my left hand. Without them, it would never have happened. Right from the inception of the program, I sat down with Dr. Ranjana, making the program as to who has to be called and who will be the chairperson, who will be the panelists, everything, doing work day and night with them and without them getting irritated. Again, anytime they have their own problems, they have their own hospital to look after, everything, they have their own patients, yet just one call, and if they couldn't pick up the phone, they would immediately get back. Thank you so much, Dr. Ranjana, my lifeline, and Dr. Charu as well, my left hand. Without delegates, nothing can happen. Thank you, all my delegates who have come at just one call. Thank you, everybody. Love you all so much, even for this something which was very new. You all came. A very heartful thanks to you all. I'm really very thankful. Then, of course, the story of cosmetic and aesthetic gynecology for me began way back in 2018 when Mr. Rahul Ray, एक कहते हैं ना, उन्होंने एक CO2 फ्रैक्शनल लाके मेरे सर पे पटक दिया. It was like he didn't even ask me कि क्या आपको चाहिए, करना है क्या नहीं है. वो लाए और उन्होंने रख दिया, madam, do something with it. उस समय से the story has started and I started experimenting. They were always there with me. बोलते थे, I could never, go ahead with vaginal aesthetics because I was not very sure. Then the studying part started. Did masters, diploma, fellowship, My mentor, Dr. Garima Srivastav, is sitting here. She was the first one under whom I did my diploma. And after that, this is the journey, my journey, and I'm in front of you all. My journey till today. Then thank you so much, Dr. Mr. Rahul Ray, Mr. Pankaj, Mr. Aditya, Rahul Gupta, Nitesh Kumar, Ramji Kumar, Rakesh Sharma, Pankaj Mishra, and Anupam Dwivedi. From these Stingray people, you all have done a marvelous job because I alone could never have reached out to so many people. Thank you once again. I'm very thankful to the pharma people who have helped us out, the event, press, and media, as you all can see, who were there, who were really nagging us. I'm sorry for that, but then they have to do that. It is their work. Hotel Moria. My wholehearted thanks goes to my hardworking and dedicated staff of Sun Hospital. Few of them are here, and one very big thanks to Mr. Chandan. I think he's sitting here. This boy has been working with me morning till night. Even if I would call him at 3 o'clock in the night, कि Chandan ये changes करने हैं, ये changes करने हैं, he was always available. Thank you, Chandan. Thank you. My special thanks to my sisters for always being there with me. And last but not the least, I would like to thank my most hardworking husband, without whom I could never have moved and done this conference. I mean, the unwavering support, the unconditional support and love he's given me is immense. Thank you so much, Dr. Rajiv. And my two loving boys who were also with me, though they're not here, but they have always with me, they have been always with me throughout from the inception of this program till date. So I am sorry if I have missed out on anybody, but then I'm extremely thankful to everybody. Dr. Kumkum, Dr. Supriya, Dr. Pragya, Dr. Anju, Dr. Neelam, everyone, Dr. Neena, Dr. Usha, Dr. Poonam, Dr. Kalpana, Dr. Zareen, Neelu, and I mean, whosoever, I'm Dr. Kamlini ma'am, and whosoever I can say, I'm so very thankful to everybody. So very thankful to everybody. Thank you all very much for making this program a grand success.
Thank you, Dr. Mini, for your heartfelt words. Thank you very much, and congratulations on this grand organization. May I request all of us to kindly stand up for the national anthem.
पंजाब सिंधु गुजरात मराठा द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तब शुभ नामे जागे तब शुभ आशीष मांगे गाहे तब जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
We thank all our dignitaries on the dais, and we'll move ahead with our next session. Dr. Charu, please.
Stage is getting ready. I request Dr. Supriya Jaiswal. She wants to highlight about one conference.
To all of you. This is, first of all, hearty congratulations to Dr. Mini Anand, Dr. Garima, and real congratulations to all the people who came for this conference. So I have to tell you that I invite all of you on 27th and 28th of July this year for the National Conference of Foxy on 27th and 28th. That is an adolescent conference, adolescent health conference of Foxy. Actually, in capacity of chairperson adolescent health committee, we have been planning this conference. Dr. Jaideep Tank as the president of Foxy, Dr. Madhuri Patel, and here we have all the our own people. It is here on Hotel Moria, Patna, here only. We have half-day workshop on 27th from 9 to 1. And then we have after lunch, we have the scientific sessions, public forum, inauguration on Saturday, that is 27th. And on 28th, we have the full day conference ending with the valedictory. We have a lovely public forum. And so I invite all the young generation to come for the abstract and e-poster presentation. And it will be wonderful having you in this conference, all of you. Until 31st of this month, we have early bird registration. Kindly register from the brochure. We have sent the e-brochure to all the groups, to all the people. You can directly do it before 31st of this month so that you can save your date and the money. And please, all of you, you're welcome to this Foxy National Adolescent Health Conference that will be based on the theme subjects like anemia, adolescent gynecology, adolescent endometriosis, PCOS. Then you'll have mental health of the adolescents. The workshop is taken care of by Dr. Alka Pandey, and she is going to have that ultrasonography and endoscopy. We'll be having all the national faculties who will come here from all over country. And so then we'll have a very wonderful academic feast. All the youngsters, please come in and have this wonderful program. तो ठीक है. So I invite everyone. Even I would have loved to have the international faculties, but your area of interest is different. But then I invite everyone from core of my heart, and warm welcome to Dr. Garima also. You do come here on 27th and 28th of July. Thank you everyone. Please participate. Anyone who want to register now, we have the booklet here. You can register right away from today. Thank you so much.
Announcement. We now move on to our next session, which is the speakers of this session is one international faculty along with our very esteemed national faculty. We have a session on labioplasty, wedge or edge, how to choose, and fullers, their use in gynecology. To chair this important session, we have Dr. Alka Pandey as chairperson. May I invite Dr. Alka Pandey, ma'am? Okay. Next, I would like to invite Dr. Meena Samant. I would like to invite Dr. Mini Anand, our organizing secretary, to chair this important session. And also, I would like to invite Dr. Garima Srivastav to do the honors. Our next chairperson is Dr. Ranjana Sinha. As you've all witnessed right from the morning, she's been on her toes. So, madam, you are invited to chair this important session.
The lunch is ready in the hall next door. So anyone who is going for lunch, it is just in next hall. And we are continuing with the session.
Now I hand over the mic to the chairpersons to conduct this important session. Joined, she is the Professor Obstetrics and Gynecology Department, Narayani Medical College, Saharsa, a Vice President of our Foxy, a very dynamic leader. Madam, we invite you and welcome you. Now I hand over the mic to her.
We are moving ahead. And I invite Dr. Saibal Ustanel for her lecture on labioplasty, wedge or edge, how to choose. Welcome, ma'am.
Esteemed speaker, we have Dr. Sibel Ustunel from Turkey. Madam is assistant professor, Obs and Gynae, and Madam has worked as many places from Bulgaria, Turkey, and she has got training from Germany also, UK. Madam, please go ahead with your talk.
Thank you. Hello again, my dear colleagues. Again, I'd like to thank the organizing committee and Dr. Garima and Dr. Mini for the kind invitation. I will talk about, I will say a few words about labioplasty today. So, as we all know, especially in the past few years, the demand for female genital cosmetic surgery is showing an incredibly increasing trend worldwide. The guidelines on the subject define cosmetic genital surgery as women seeking a medical or surgical intervention due to the discomfort they feel from the appearance of their external genitalia, which makes understanding the reason for seeking surgery is the key for a successful operation. On the other hand, understanding a woman's motivation for cosmetic surgery requires a careful and sensitive exploration to ensure her autonomy and rule out the possibility of exploitation by another person, such a family partner, family member, or a partner. Which lead us to define concept of normal, because the desire to be normal is consistently reported by women as a reason for seeking surgery, but how to describe a normal appearance of vulva, that remains unclear, because unfortunately there is no such of definition. This is so-called the Great Wall of Vagina, made of selected sculpture pieces of vulvas by a sculpture artist, Jamie McCartney. This piece of art is very famous in the world of female genital cosmetic surgeons because it describes the enormous variability of appearances of female external genitalia. As you can see, there are so many variations, and each of them so-called normal, each of them is a normal anatomical variation. Because despite that, even the term hypertrophy of the labia minora is occasionally identified as a normal variant. More than that, the definitions of hypertrophy in themselves are problematic because there are no consensus about the range. There are indeed some classifications, but these classifications are developed by surgeons who work in this field, so they could be biased and promote a limited definition of normality. If we can draw a border to mention of normality, why hundreds of thousands of female in all over the world every year seek for cosmetic genital surgery? Because the perception of normal changed as desirable. Shaving, waxing, laser removal of the pubic hair let us allow a better view of external genitalia. On the other hand, there is a widespread use of the internet that allows an increased access to pornography, in which starring women has already undertaken to some kind of medical or surgical female genital interventions. Women's and men's magazines are full of digitally modified photos, and all of these stuffs has changed our perception of normal. So how to describe a desirable and ideal vulva? According to the surgeons who are working in this field, an ideal vulva should be small, clean and discreet and tucked away, and not only minimal and unextended, but also symmetrical and homogeneously pinked, which this way is often compared to a childlike state of external genitals. As understanding the motivation of the patient for a successful and satisfied by the patient surgery, it's very important for us to possess the knowledge of anatomy of the area that we're working on, especially the map of the arterial supply of the labia minoris. In the field of cosmetic gynecology, we are not dealing with very hard or major operations, but in the end of the day, it's operations, so although we can encounter very frequent or serious ones, complications still can occur, like in all areas in surgical interventions. Since labiapneuroplasty is the most commonly applied intervention in this field, complication rates are higher in this procedure, and these complications such as dyspareunia, scar retraction, sensation changes, hematoma, and dehiscence are most often caused by a damage of the central artery. Hence, it's very important to ensure continuity of the central artery, of the arterial supply. This is so-called the central artery. This is so-called the central artery, which assure the main arterial supply to the labia minoris. Contributions from the external pudendal artery provide the blood supply anteriorly and medially to the labia minoris. The blood supply of the posterior system is provided by the internal pudendal artery. When performing labiapneuroplasty, long story short, in order to ensure a healthy wound healing and a successful postoperative outcome, it's very important to be sure that the continuity of the blood supply will be ensured when deciding which technique to apply and how much tissue to remove and where to remove it from. About the classifications, we can say nobody worldwide actually uses this classification in daily practice to define normality, because the size, shape, pigmentation, and volume of the labia minoris are a matter of socio-cultural aspect. And the volume of the labia minoris is a socio-cultural aspect. If a woman is not happy with the appearance of her external genitalia, it doesn't matter what the classification says, what is normal or not. But still, before we start with the techniques, I would like to talk about a little bit about the classifications, because they in fact are helpful to understand which technique is more appropriate for which patient, for which case. We will talk about the two most popular classification in the literature, and one of them is the Motakev's classification. But I need the picture to explain that, yeah. Motakev's proposes a simplified classification system for labial protrusion based on the distance of the lateral edge of the labia minora from that of the labia majora, rather than the introitus, like as in the other classification systems. The first classification in the first classification system in this field is the Franco's classification. Franco's defined the labial protrusion from the introitus to the free labial edge of the labia minora, but Motakev's classification is more detailed for explaining of the hypertrophy. Now, if the labial width from the sulcus between the labia majora and the labia minora to the prominent point of the labia minora on the lateral edge is no more than 2 centimeters, it's class 1. If it's between 2 and 4 centimeters, it's class 2. And if the labial width is more than 4 centimeters, it's class 3. Banwell's classification is more about where the prominent point of the labia minora is seen than the size of it. In this classification system, the labia minora are divided into 2 morphological types. If the most prominent point of the labia minora is in the upper third, it's type 2. If the most prominent point is in the middle third, it's type 2. And if the most prominent point of the labia minoras are in the lower third of the perineum, it's type 3. On this slide, you can see different labia minoris according to the Banwell's classification. For example, this one is Banwell type 3. This one is Banwell type 1. This one is Banwell type 2 because the prominent point is in the middle third. Banwell type 1 and Banwell type 3 are very suitable cases, very suitable types of vulvas for wedge resection especially. But Banwell type 2, since the prominent point of the labia minoris are in the middle third of the labia majora, may be more appropriate for the edge resection. But of course, regardless of the classification, you can apply any technique you deem appropriate in every case. Direct incision technique is also known as edge resection or trim technique. This technique is especially suitable for patients whose main complaint is hyperpigmentation because, as you know, the hyperpigmentation is common with labia minora, especially on the labial free edge. That's why it's ideal when hyperpigmentation is present. It's a very simple technique with an easy learning curve. You just simply cut out the aids. Cut out the aids with scissors, scalpel, radio frequency, or laser. The biggest advantage of this technique is that the risk of dehiscence is very low and it provides convenience, especially in cases to be combined with hoodplasty. The biggest disadvantage is the high risk of scar retraction. Now, first of all, we mark the end of the labia we will remove, and once the first site is marked, the second is marked as well, using the mirroring technique, which is done by bringing both labia minora towards midline, so the ink of the previously marked labia is traced onto the other. In the beginning of my experience in this field, I used scissors and scalpel, but lately, especially in the past 2 years, I started to use a high frequent radio frequency because the aid of the device itself is very thin. It's as thin as a hair itself. So it allows you to make very delicate decisions, and it's very useful, especially when you are making hoodplasty. It's very important to avoid hard pulling the labia while cutting, otherwise you will cut more than you planned. Resection is done in a beveled way, and remember to always leave other border a few millimeters longer than the inner border. This is the key to right coverage with suturing and preventing retractions and visible scars. By the way, the two labiums are not exactly the same, so don't ever try resecting each labium equally. A meticulous hemostasis is very important since the labia arteries can bleed a lot and cause late hematomas. These little teeny tiny blood vessels that we are major surgeons. We are doing hysterectomies, we are doing cesarean sections. So that kind of bleeding that the central artery bleeds when we are doing labioplasty seems like non-important to us. But these little teeny tiny blood vessels bleed a lot. And since we are doing a cosmetic surgery, the wound healing and the final look of the wound, of the scar is very important. And a hematoma of 0.5 centimeters even can cause a very serious scar retraction and dehiscence. So meticulous hemostasis is very important while doing labioplasty. I'm doing a lateral wedge resection to the clitoral hood here. I will say a few words for clitoral hoodplasty later. This is a deepitalizing technique of labia minora. That was the first actually prescribed technique for labioplasty in the literature by Goodman himself. From the most protruding part of the labia minoris via wedge resection. Over the years, different modifications of the technique have been developed by research surgeons, and studies have shown a high patient satisfaction rates and a very low complication and reoperation rates. But always do remember, despite it keeps normal anatomy of the furry labial edge, it can cause color mismatch because hyperpigmentation can be irregular throughout the labia minora itself. The biggest disadvantage of the wedge technique is the high risk of dehiscence because we are cutting the continuity of the arterial supply. So sorry. When the power cut out, I keep that slide. This is a little trick that I learned from one of my mentors. In the literature, you may have across articles stating that the central artery can be easily seen during the operation when viewed in the dark with cold light. If you ask what a cold light is and where to get it, you don't need any special device. The flashbacks of our mobile phones are kind of a cold light. In this case, for example, one of the nurses helped us with the flashlight of her mobile phone. You can easily see the mapping of the central artery here. It's enough to stay away from the central artery while doing the cutting, because when we cut the central artery, we will cut the arterial supply of the labia minora, which can cause necrosis, which can cause scar retraction, which can cause hematoma, and as a late complication, which can cause dehiscence. So sorry for that. I'm returning to the wedge resection. Just like on the trim technique, first of all, we mark the area of the labia we will remove, and once the first side is marked, the second is marked as well. You can use scalpel, scissors, radio frequency, and lasers for cutting, just as in the trim technique. The trick is here, when cutting the wedge, be very careful to keep resection borders straight. Not curvilinear, because the curvilinear resection borders can cause higher rates of dehiscence. The marking part is very important. I spent approximately 25 to 30 minutes just for marking before starting the operation, because with marking you imagine what kind of post-operative results you will have, where to cut, how much to cut. So marking is very important before the operation. Now cutting, make a perpendicular incision. While making your incision, make sure the person holding the labia keeps a constant grip without an excessive tension to prevent surgeon from making a curvilinear resection. You can use any absorbable material for suturing. Vacral 4.0 will do the job perfectly. Always use a deeper layer of subcutaneous stitches and then a superficial one. And just remember to pay close attention when bringing both resection sides at the distal free labia border, because About composite reductions, actually this is my favorite technique. For the past 3 or 4 years I've never done an edge resection or a wedge resection because I almost always had a hood plasty while doing the labia minora plasty. It simply contained a trimming to the access tissue of the labia minora and the clitoral hood, as opposed to the other procedures that are fundamentally based on a reduction of the labia minora in the part below the clitoris. The composite reduction entails labial tissue reduction as well as the removal of the tissue located cranial or caudal of the clitoral hood. In composite reductions technique, for cutting and suturing is the same as in the edge resections, and we face the same complications as in the trim technique. This is a Barbelook vagina, Barbelook vulva operation with composite reduction technique. With high frequent radio frequency device again. This is one of my professors that I've learned everything from. He's doing the operation, and I filmed it. You see how delicate incisions and how delicate hemostasis the radio frequency can do. Because the clitoral hood is a very sensitive and very, very important area for the female sexual function. It's very important to be delicate, it's very important to be careful there. High frequent radio frequency devices are extremely appropriate for clitoral hood resection. This is the final look after the composite reduction. I'm not covering the clitoral hood. Okay. Okay. Thank you for your attention.
Wonderful presentation, Dr. Sybil, and the composite technique is really very nice. I would just like to ask you, what are the sutures you prefer when you are doing your surgeries?
Monocryl sometimes.
Monocryl.
When I do very deep incisions, if the labral hypertrophy is class 3 according to the Motakevs, which means the prominent point is more than 4 centimeters, the labia minora itself becomes very voluminous, so they were very bleeding and preparing to patients to have hematomas after the operation. If I reduce a very large tissue, I always use monocryl. But beside that, 4.0 vicryl is enough for every kind of surgical intervention in this area.
Thank you. Thank you so much.
Thank you.
Thank you, Dr. Sybil.
Thank you.
Thank you. Thank you. It was a wonderful presentation.
Thank you.
People have left their lunch and are sitting here just to listen to you. Thank you.
Actually, well, mostly you were talking about, the women who have clitoromegaly and hypertrophied labia. Now, because, the women in Africa, they have, who have been subjected to female genital mutilation. So do you have any cases, of that kind where they have been subject to female genital mutilation where the problem is just the opposite? And what would you do in such cases?
I have a couple of patients from South Africa which have been emigrated in Turkey, and we've done some revision operations for genital mutilation. We are wrapping flaps of vaginal tissue to recreate labia minora like something for closing the introitus at least, but the genital mutilation is that means total resection of the labia minoris and total resection, total destroying of the introitus. So it doesn't matter how many flaps you're wrapping from the vagina itself. It doesn't look like a normal vulva, but at least we can assure a painless sexual intercourse to the patient.
So you take the flaps from labia majora?
No, from vagina.
Okay.
From vagina, from vaginal tissue.
Because I've seen patients like that, because I've worked in England for 5 years, and there were many patients,
Yes,
of that kind.
yes.
And I've seen them, it was so difficult at the time of cesarean section because you couldn't find the urethral meatus at all.
Yes.
So that's why I was just intrigued to know, because here it's more like refashioning and cosmetic kind of. So what about the other women for, the other category of women for whom it's a necessity rather than
there are very difficult cases. I've done 3 operations like that, and in each operation, an urologist and a plastic surgeon were with me because as you said, you can find the urethral meatus. Sometimes you can find even the rectovaginal fascia because the mutilation, the reduction is so deep that rectovaginal fascia is destroyed, all of the introitus is destroyed. You can see just closed skin, and you don't know where is where. So they are very complicated operations and requires a urologist, a plastic surgeon, and a gynecologist.
But one could still give them a comfortable sort of life, perhaps.
At least, the vulvar appearance is never look natural, of course, but at least they can have a sexual life without any pain.
Okay, thank you so much.
Thank you.
Now, Ish Prajapati to give his talk on fillers, their uses in gynecology. He will be introduced by Dr. Ranjana.
So, Dr. Nitesh Prajapati is a consultant dermatologist, cosmetic sexologist, and aesthetic gynecologist. Sir is director of Moksh Skin Hair Clinic, Mantha Sexual Health Clinic, and All India Institute of Aesthetic and Cosmetic Surgery Academy. Sir, kindly continue with your talk.
Thank you. Hello, everyone. And thank you so much, ma'am, for inviting me an introduction. My topic is dermal filler. What is the dermal filler? During the aging process, the face loses the fat and volume while the skin loses collagen and elasticity. Injectable filler are used to restore and youthful the appearance. What is the type of the filler? There is the temporary and semi-permanent and permanent. And temporary having hyaluronic acid, this is most common used filler in India. And second one is the biofiller. And in semi-permanent, calcium hydroxyapatite and polylactic acid, these are the body filler also. And permanent, the silicone implant and fat grafting. This is the particular faces indicated area where we are injecting the fillers. Now this is the hyaluronic acid. These are the non-animal stabilizing hyaluronic acid as known as a NASA family. These are non-permanent filler easily dissolved with the hyaluronidase. These are having low potential for the allergic response. They can last from the 6 to 18 months depending on the location and amount of the product injected. And hydration and BMI play an important role in the life of the dermal filler. Hyaluronic acid is naturally found in the skin. It is basically provide in our skin. This is a hydration, and in higher concentration, it work like a jelly form, and it work like a filler. And it started from and reformed and now has become one of the most popular kinds of the injectable filler. Hyaluronic acid is also a major component of the skin where it is involved in the tissue repair. And what is the hyaluronic acid? Actually, hyaluronic acid is a kind of the two type, cross-linked and non-cross-linked. Cross-linked hyaluronic acid is work like a injectable filler, and non-cross-linked hyaluronic acid is work like only the collagen inductor, not a filler. What we use commonly are the hyaluronic acid injectable under the India, and cross-linked hyaluronic acid filler. How we can identify the dose should be between 2 to 26 milligram per ml. And which one is available in India? Mostly US FDA approved, Juvederm, Allergan, Restylane, both are costly also. And Korean FDA approved, Monalisa, Belast, Saifa, and etc. And Chinese filler, Aqua Plus, Equicuteus, Eduramis. These fillers are available in India. And these are the pictures. Mona Lisa, Saifa, Belast. And these fillers are in only 1 ml of the syringe. And these filler are the body filler which is available in India in the 10 ml and 15 ml in syringe, which is required for the body filler. Just show the labia majora, and this is the best filler. Indication of the hyaluronic acid filler: complete facelift, deep wrinkles, breast augmentation, hip dip, BBL, and vulvar fillers, penis enlargement, vaginal atrophy, necklines, and deep scars. Contraindication of hyaluronic acid: allergy and hypersensitivity, pregnancy and lactation. Complications which are occurring during the procedure after the hyaluronic acid filler injecting, mostly vessel punctures lead to the pain, bruising, hematoma and necrosis, and artery puncture may cause the occlusion. And treatment which be given after the filler injecting, that is antidote, Hylase. Hylase is a brand which is available in India, that is containing hyaluronidase enzyme that dissolve the deposited hyaluronic acid within 6 hours. Procedure must be done by cannula technique instead of needle technique to avoid the above complication. Because of needle having the sharp and cannula having the blunt, that will not rupture any kind of the vessels and capillaries. And now this is the biofiller. This is modified form of the PRP, which is derived from our body and plasma, making one of the safest filler on the market. It provides consistent volume, shape, and rejuvenation because of it having growth factor of the PRP, and and this is better than hyaluronic acid. And one more thing is, hyaluronic acid having migration property, and biofiller having no any kind of migration property. And what is the centrifuge method of to make the PRP? That is a first spin 800 RPM for 8 minutes. After the extracted the triple P, poor platelet plasma in normal tube, again second spin for 2500 RPM for 12 minutes. After that, we mix the calcium gluconate, that is activator, it is in the proportion of 1:10. That was we incubated in hot water or boiling water at the 100 degrees centigrade for 5 minutes. After that, in cold water for the 10 to 15 minutes. Next procedure should be the tie-back cannula until unless it get modified the gel consistent. This is the biofiller. Vaginal filler. This is most commonly used in cosmetic gynecology, and loss of volume in the labia majora and loss of the tightness. Vaginal filler can help restore the natural shape and volume of the labia majora, including deformity of and dimple of the labia majora. And this is an injectable site where we inject the filler both in bilateral majora and perivaginal wall. This is the vaginal atrophy, and this one, first one is a healthy vagina, vaginal atrophy after the procedure of hyaluronic acid. Post-care vaginal filler, for 5 days, no sexual intercourse, no gym, no cycling, no bath. A result of our vaginal filler outer labial enlargement lost on average 2 year. Result of hydration or constriction last average on 18 months. You may need another second one after the first session. We can inject after 6 months, depend on the severity of dryness. This is my case, which is done by the cannula technique, hyaluronic acid filler. And second one is the biofiller by the cannula technique. And now, this is G spot. आप लोग गायनेकोलॉजिस्ट हैं, आप लोग को सब अच्छी तरह से पता होगा कि वेयर इज द जी स्पॉट, Gerpenberg spot. This is known for the intense orgasm. Now the technique, I am using the 2 ml of the PRP, and after that 1 to 2 ml of the soft hyaluronic acid filler. Hyaluronic acid filler is a kind of 2 fillers, just a kind of the hard and soft. हमको यहाँ पे सॉफ्ट फिलर ही यूज करना है, hyaluronic acid का हार्ड नहीं यूज करना है. और मैं यहाँ पे जनरली PRP इसलिए यूज करता हूँ कि बिकॉज ऑफ द जी स्पॉट एरिया रप्चर हो जाता है, डैमेज हो जाता है ड्यू टू मल्टीपल बार्थ एंड मल्टीपल उसके रीजन्स होते हैं. तो PRP will get the neurogenesis, and after that filler will get the amputation. And result be time to final result 3 to 6 days. Longevity of the filler 6 to 9 months, depending on the product. And this is my filler pictures in the breast area. I'm running few videos. This is bono thread. By cannula technique, hyaluronic acid. This is a 10 ml syringe of hyaluronic acid filler. Thank you so much.
Dr. Nitesh, that was such a information dense, crisp lecture. Thank you so much. And I guess
Thank you,
filler
ma'am.
is one topic जो कि हम gynecologists थोड़ा डरते हैं, and you have made it so easy. Just one question. You prefer, for labia majora, do you prefer the biofiller or do you prefer this?
Ma'am, biofiller.
You prefer biofiller. You do most of your cases with
All
biofiller.
the cases, ma'am. I'm used to.
Okay, great.
बायोफिलर से 2 बेनिफिट होंगे, एक तो वेजाइनल रिजनरेशन मिलेगा, सेकंड वन वॉल्यूम भी मिलेगा, तो दोनों बेनिफिट मिलता है उसमें. तो कोलेजन इंडक्शन भी होगा साथ में एंड वॉल्यूम भी रिस्टोर होगा, जो कि hyaluronic acid में चीज़ नहीं मिलेगी.
How do you prepare this biofiller? Similar to PRP?
नहीं, नॉट टू सिमिलर टू PRP. इट इज डिराइव फ्रॉम द PRP. PRP को हम जैसे मान लीजिए हम लोगों ने 20 ml हमको बायोफिलर यूज करना है बायोलेटर मेजोरा में, 20 ml अराउंड लगता ही है. तो हमने 40 ml ब्लड लिया, 40 ml का 50% हमारा बनेगा प्लाज्मा, दैट इज PRP. ड्यूल सेंट्रीफ्यूज करेंगे, उसके बाद उस PRP को हम 20 ml की सिरिंज में फिल करके 100 डिग्री सेंटीग्रेड बॉयल वाटर में उसको हमको हीट करेंगे फॉर द 5 मिनट. आफ्टर दैट चिल्ड वाटर टेम्परेचर शुड बी बिलो 10 डिग्री सेंटीग्रेड पे 15 to 10 मिनट के लिए उसे हम चिल्ड करेंगे. उसके बाद फिर टाई कैनोला से हम उसको डाइल्यूट करके और फिर हम इसे इंजेक्ट करते हैं.
Very nice technique. Thank you, Dr. Nitesh.
Thank you, chairpersons and the speaker, for a wonderful talk. There's a slight change in the program once again due to online lecture by Dr. Salman Khan. For that, may I request Dr. Ranjana Sinha to kindly take over. Thank you, madam.
So now it's time for our online deliberation from Dubai. Uh, we have our speaker, Dr. Salman Khan.
Hello everyone, I'm Dr. Salman Khan, consultant plastic surgeon, and it's a great pleasure and privilege.
So may I invite our esteemed chairpersons for this session. So first of all, may I invite our esteemed chairpersons, Dr. Anju Turier ma'am. Madam is Director, Matritva Clinic, ACMO Begusarai. Madam has been President BOGS 2019-21. Madam has been past Vice President AOG SBJ and a faculty at various national and international conferences. Welcome, Madam. Madam Anju Turier. Next, I would like to invite Next, I would like to invite Dr. Zareen Rahman, Senior Consultant, Ex-Deputy Director, Kurji Holy Family Hospital. Madam has been Vice President Patna Parb. Madam is Vice President Patna Parb for the year 2024-26 and Executive Member Patna Menopause Society, year 2024-26. Madam is also Fellow Representative RCOG East Zone, India for the year 2018-2014. I think all the chairpersons are taking lunch. So, and the third chairperson is Dr. Pragya Mishra Chaudhary, a very dynamic personality. She is Secretary General ISOPARB, Founder Secretary, Bihar Chapter of ISAR, Vice President POGS for the year 2021-22. Dr. Pragya has been chairperson. She is not there. Okay. Of Genetic and Fetal Medicine Committee 2021-22 and at present consultant infertility specialist at New Life Test Tube Baby Center and MGM Hospital. So let us now begin with our talk of Dr. Salman Khan. No one is there. Interest in body contouring and cosmetic plastic surgery. Sir is international trainer for liposuction, fat transfer, cosmetic gynecology, and hair transplant. So let us continue with his talk.
Hello everyone, I'm Dr. Salman Khan, consultant plastic surgeon, and it's a great pleasure and privilege for me to be speaking to such a wonderful audience. It's a great opportunity to share knowledge across borders, to share our work, to share how we are proceeding and progressing in the field of medicine and surgery and cosmetic gynecology. Today I'll be talking to you about mommy makeover,
So
the
I
surgical
welcome
aspects.
Dr. Anju Turiya and Dr. Zareen Rahman, our esteemed
Mommy makeover
chairpersons,
is booming
to the
in
dais.
popularity. It is equally liked by patients, gynecologists, and plastic surgeons. Doesn't come unless and until you have done contouring of this rectus muscle. So we do rectus plication in the lower abdomen as well as in the upper abdomen. And this plication ultimately leads to the perfect shape. After we have done that, we reposition the umbilicus if it's needed. Now we even do a type of abdominoplasty where we call it a floating umbilicus abdominoplasty. There we just cut out the stump, we reposition the skin, and then the excess skin is excised and stitched back. So this diagram is just to illustrate the basics of the procedure. Now, the full tummy tuck and the mini tummy tuck, there are certain key differences. The incision, the elevation of the skin flap, the approximation of the muscles. These are the three major differences between the mini tummy tuck and the full-fledged tummy tuck. I personally like to do full tummy tuck in every patient who has been through pregnancy, unless and until some patients that I have come across who are very, very careful with the exercise, those mostly who are gym instructors or yoga instructors who are very careful about their bodies, only they need this mini tummy tuck. Majority of the patients require a full-fledged tummy tuck. This demonstrates even better the level of dissection and the level of skin flap elevation. This is the skin flap elevation, and we like to dissect until the xiphisternum so that we can plicate the muscles in the center and then stitch back the maximum. So a combination of tummy tuck and liposuction is booming these days. This is the ideal procedure. I love it because with a combination of liposuction, you're able to reduce the fat from the sides and you're able to stretch the skin even more. That gives you the better result. Now, I'll start off with the worst cases that you can come across. Somebody who doesn't take care of herself. Somebody who has gained a lot of weight. They are not willing to reduce the weight before going for the tummy tuck procedure, but you can see there is a lot of fat, umbilicus is hanging down, there is excess skin. So I do the markings. These are the markings for liposuction. I told you about the diverse test. The lower incision is easier to mark, but this upper limit is actually from the diverse test where I identified, but this is not the one that you'd always go for. We always recheck after the dissection and rectus plication. Maybe this mark is not ideal. Maybe I need to safeguard a little more skin so I can come down. And these are my markings for the liposuction. So I'm doing the upper abdomen, I'm doing the love handles. I'll be doing liposuction in this part as well because when you inject tumescence, and that gives you a much better hemostasis. And after the liposuction, when you're doing tummy tuck, that makes things really, really easy. Now, if you could just play the video. Now, a little bit about liposuction. See, this is how it's done. I have a cannula. I'm holding the skin in my left hand. My left hand is actually the guide, and the fat is coming out through this suction machine. Since I'm not collecting fat in this case, so it is just going down the drain. It's collected in the suction bottle and we'll discard it later on. Now, after liposuction, see, it's the same patient. Now you have such good access of skin. Now you already are in shape. So this is the case where we did the liposuction, the fat that we took, and then the extra skin that we took out. Now, in this video, it would give you an idea of how things look. See, it's the same patient. And later, the diverse test that I did initially, incision was above the umbilicus. But then I realized I need to stay more conservative in order to get a much better result. So things vary. I told you I'm going to start off with the worst case because the patient needs to put in a lot of effort if they are going into mommy makeover. They need to hit the gym hard and then come back for mommy makeover. But still, this is an acceptable result, and the patient was very happy with the current look because there was a lot of excess abdomen. She could not wear good clothes, but now things have improved. Now, this is another patient, and she is a mother of 3, aged 33, and she is the one who loves the gym, who has done her diet and exercise, and then she came back to me. So she has lost all the fat already, but still she wanted a much, much better result. So I planned for liposuction in the upper abdomen, in the mid abdomen, also the love handles. On the sides, you can see the markings. Now, this is where you could see the excess skin. She has lost a lot of fat, but still there is excess. We did liposuction, about 2500 ml. This is the level of dissection. I went right up to the xiphisternum. This is the excess skin, about 8 inches on each side. So in total, it reduced about 12 inches. And this video depicts the real mommy makeover when the patient has put in her effort, taking out the skin. You see the perfect S-curve, the perfect shape of umbilicus, and the skin, the incision line, it would be hidden in the bikini line. So this is when you get a patient who has a much, much better response to diet and exercise. And such patients, they get amazing results. So I always counsel my patients that you need to have a very good diet and exercise and gym in order to get a good result. Now, just a few pictures showing you even better results. This patient came up after 2 pregnancies. You could see the sagging of the breasts. So what I did was we did liposuction, and we also did the tummy tuck. The incision line is hidden below. And we did mastopexy to lift the breast. She also wanted an increase in size, so we added implants. The next patient, she also wanted increase in size of the breast, so higher implants were put in, about 360 ml. And we also removed all the excess skin and the incision line that you could see and the perfect curve, repositioning of the umbilicus. Another patient, she had these 2 folds in the abdomen. Such patients are very, very conscious about the looks, and she has a lot of sagging. She tried her best. She tried to lose her weight, but the shape was really bad. So we did augmentation. We did mastopexy, the breast lift. You could see the incisions, the drains are in, and the implants are there. And we also did excision of the lower abdomen skin. Another patient, another mommy makeover, incision to remove the skin, a perfect shape, and implants to add, but with mastopexy. Another patient, another way of showing the results. See, you can appreciate the scar. It heals really well. And there was also a breast lift in this patient. Just a little bit about the arm lift, which I told you initially. We call it brachioplasty. So this excess skin in the arm, you can remove the fat and you can also remove the excess skin. This is how we do it. We mark, we remove the excess skin, and we stitch it back. It's a pretty straightforward procedure. You can see the change. Post-op care, as of any wound, you need wound dressings, you need painkillers, antibiotics, and most important thing, compression garments, at least for 8 weeks after surgery. There could be some complications which could be associated with any other surgery, like bruising, bleeding, hematomas, seromas. They are very common, particularly with the tummy tuck. And there are certain ways of dealing with it. One of them is to do your dissection at the level of scarpus fascia. So you leave a fat-to-fat interface, and that interface actually develops the lymphatics early on, so you don't get a lot of seromas. Scars, some people are happy with them, some are not, but you can do some scar modifications later on. Infections can happen. It's ideal to be careful with all the steps. Thank you very much for watching. If there are any questions, I'll be happy to answer them. And I hope you're having a great conference, and hope to see you soon. Take care.
Anyway, Dr. Salman is not here still. I'm thanking him for his elaborate talk. That was quite. Thanks for
Hello,
elaborate talks.
everyone.
Hi. From the audience, I'm just asking, anybody has any question? Any question from the audience? Pragya, you want to ask something?
At the outset, I would like to thank the organizing chairperson and organizing secretary, Dr. Mini Anand, for this opportunity. And thank you, Dr. Mohammed Salman Khan, for this wonderful lecture on postpartum makeover. Now, well, from what I gather from your lecture, that, mothers don't have, in the Indian setup, you would call them after deliveries that they look like mummy ji. So it's high time, and you have opened up a new horizon for these moms that, even after delivery, they can still look like models. So there is hope, for all these women who even after 2 or 3 deliveries can go back to their beautiful shape which they had before delivery. So thank you for highlighting and enlightening us on this topic.
Do you have any questions to Dr. Salman Khan? Anyone? Okay. Yes, ma'am. Yeah. Yes,
This is Dr. Kumkum
Yes,
Sinha
please. I'm here.
this is Dr. Kumkum Sinha from Patna. A very good your talk was there. We liked it so much, and you have given so much detail after the different procedures. We were very much impressed. I just want to know, when you are doing this tummy tuck and all, you take over so many skin lesions with the fat. What do you do with that skin part that you have taken off from the patient? Do you preserve it for some other utility on some other patient, or you just throw it off, or you just preserve? What is happening to the skin lesions that you take off with the fat?
Thank you very much. It's a very interesting question. I really liked it. I want to do something with the fat, but we do a lot with the fat that I've taken. Mostly it is transferred to the breasts or to the buttocks to improve the shape, or even to the face. People love bigger cheeks. They want to contour their jawline. That is also part of mommy makeover. So we have a lot of utility for fat, but I'm sorry we are not using the skin as such. It should be used. It can be used to develop keratinocytes, which can later on be used for burn patients. That would give you a layer of dermis, particularly the acellular one. So, but currently we are not using them.
So this is human living tissue that you're taking out, so it should be put in some use for, I mean, so many genetic and this and that, and testing of certain research products, researches that are going on in this fast growing academic development in the medical field. So I would like to put your thoughts into that. Thank you so much.
Thank you very much for a very insightful suggestion. I'll definitely put it into my practice. Thank you.
Hello, Dr. Salman.
Yes, please.
I'm Dr. Mini Anand here, and I'm with Dr. Garima, and we are conducting this conference. There's a hall full of people, as you can see. So
Oh, yeah.
I hope you're able to see, and or you've seen. There was a slight power cut. That's why we had this problem. So your lecture was just awesome. You know, that's why people have so many questions, and you're doing so great, so much of work for the post mommies, post delivery mommies. So thank you very much for that, and thank you very much for being with us at the Irag Congress. You've been throughout. You've been of great help. Thank you. I can't thank you enough. Thank you so much once again, Dr. Salman.
Oh, thank you very much. It's a great honor. I thank you, Dr. Mini. I thank Dr. Garima for inviting me over. And it's a wonderful gathering that you have out there. I've been following the pictures in the group, and I truly congratulate you on the wonderful effort that you have put in. Thank you.
Hi, Dr. Salman, Dr. Garima this side. It was lovely to hear you far away from here, and hope to see you soon in Dubai.
Yes, see you soon there in June, inshallah.
Okay, have a great day. We'll disconnect very soon. Thank you so much for your lecture. It was wonderful as
Thank
usual.
you. Thank you very much. Thank you, everyone.
So, thanking Dr. Salman for the wonderful lecture and our chairpersons for wonderfully conducting this session. We would like to felicitate our chairpersons. May I request Dr. Garima, Dr. Mini, and Madam Renu Rohatgi on stage for felicitating our chairpersons, please. Ma'am, to present a memento to Dr. Anju Turier, ma'am. May I request Dr. Garima to present a memento to Dr. Pragya Mishra Chaudhary. And may I request Dr. Mini to present a memento to Dr. Zareen Rahman.